We can see people dying. We see people going blind. We see people losing their limbs.
An African American male lives about 6 years less than his white neighbor.
You stay sicker longer and you die sooner. That's the end result.
All of that is directly related to the kind of health care services that we receive in our communities.
We have a really terrible problem in New York City. It has a great healthcare system if you're well insured. And if you're not, you could end up in a pretty bad way. The private academic medical centers operate two completely different systems of care. They operate a system of care for people who are privately insured, managed by the most experienced, most sophisticated physicians in every specialty area. And then they run the training system. And the clinics are basically run by interns and residents. That's where the medical students train. And the people without insurance will end up there. The systems of care are very, very different in terms of their quality.
I was getting care at a teaching clinic. I almost saw a different doctor each time I went. And after waiting long periods of time, I made the decision to not go back anymore. It was a waste of my time. I wasn't getting any help.
I feel like, how dare you? How dare you feel like I don't deserve to be treated? How dare you feel like because I'm on Medicaid, because I have managed care, I don't deserve to get the same treatment as someone else?
Un día estaba llamando al hospital para hacer un appointment con un doctor. Le digo yo a la recepcionista que tengo un plan de salud que da el Estado que se llama Health REACH. Y ella me responde que el appointment mío sería para septiembre. Cuando yo estaba llamando era en abril y para septiembre yo dije, pero ¿qué es esto? Esto no puede ser, si hasta allá yo me muero porque tengo una infección. Llamé al mismo número. Hablé con la misma recepcionista y pregunté por un appointment con el mismo doctor, y cuando ella me preguntó qué tipo de seguro de salud tiene, pues yo le respondí el de mi trabajo, que es United Healthcare. Inmediatamente ella me responde y dice, puede venir la próxima semana. Para mí eso fue frustrante al ver que a las personas se lo tratan en dos formas.
Let's just take the issue of having to see a different doctor every time that you come in. That in and of itself will delay any diagnostic or treatment program that you're dealing with, because you're now having to deal with schedules of different physicians at every single visit. I mean, we saw delays in diagnosis of up to 6 months, and then another delay of treatment after that for another 3 months. A 9-month delay in a cancer diagnosis could be life or death.
When I went to you, it was probably stage 2 cancer. Instead, I had to wait all those months, almost a year, and it's stage 4, and it was everywhere. And I think that's what the problem is in the clinics in New York City, is that you get largely ignored until you can't ignore it anymore, until it's impossible to ignore.
The reason we call this the segregated care problem is because when you separate patients based on insurance in that way, given the demographics of who's on Medicaid and who's uninsured in New York, you're also separating people based on race. Under civil rights law, if you are a hospital, for example, and you have a policy where you're separating patients into 2 different systems of care based on insurance, even though on its face that's not racial discrimination, if it nevertheless negatively and disproportionately impacts communities of color, that's unlawful under federal civil rights law.
We still have a black door and a white door to health care. This is to me, is just as bad is making me sit on the back of the bus.
It is de facto racism because it operates like racism.
We've looked at other places around the country, and some of the best named institutions, the Mayo Clinic, Brigham Hospital, we've talked to people there. They take care of everybody in the same place, at the same time, in the same way.
Nosotros somos seres humanos, todos dignos de tener el cuidado igual que otros.
I don't think that the change is going to come unless the community gets angry and find a creative way to express their outrage.
For example, I'm going to give you an example. Years ago, I'm a fighter, and I just believe justice for all. This segregated care makes me feel sad. It makes me feel angry. It makes me feel that I have so much more work to do with all of the work that we've already done.
Hold your community leaders, in particular, your political representatives, accountable. Find someone who will take the time to hear your case. You are an individual. You are not a number.